Hello, everyone. Thank you so much to the organisers of this amazing conference for the invitation, and it's been really exciting to meet some of my heroes in the flesh, so a great time to come to Brussels. So we have a crisis of medical ethics, not just in the UK where I am, but globally. And I think most people probably realise by now that something has gone very wrong. Humanity has lost its way. And I think that to get out of this mess, we must bring the conversation back to fundamental ethical principles. So I'm a massive fan of the US Founding Fathers. I think they had a profound wisdom and understanding of human nature and human frailties. And they worked out what was required to create a free and just society. And so Thomas Paine noted 250 years ago that the greatest tyrannies are always perpetrated in the name of the noblest causes, and how true that is. So in response to the COVID policy crisis, I would say rather than a viral crisis, it's been a policy crisis, I co-founded the UK Medical Freedom Alliance with another doctor in October 2020. And over the last 2 years, we have written over 50 fully referenced, evidence-based open letters to governments, regulators, decision and policy makers, basically anyone that we can think of, including 9 relating to the children's COVID vaccines, specifically on authorization, safety, lack of benefit. We've written letters to media figures who've directed propaganda at children, and we've also challenged the concept that under 16s could possibly give informed consent, known as Gillick competence in the UK, which was undermining parents' rights to make medical decisions for their children. Sorry, just pop back. So we've also produced many reference public information leaflets because we feel that to enable informed consent, the public need information. We've produced legal template letters to help people to challenge medical freedom issues where they are, say, they're being refused medical treatment without masks or tests or vaccines. We have a legal template letter which they can use to assert their rights. And we've also come together with the Alliance for Natural Health International and produced some COVID vaccine medical exemption forms which can be used anywhere in the world. You just need either a friendly doctor to sign it for you or you can sign it yourself. So that's worth visiting. It's a good resource. And specifically relating to the Hands Off Our Children campaign, it's worth noting that the UK Medical Freedom Alliance wrote the first of 9 open letters relating to children to government, child health experts and regulators in February 2021. So this was when we were being told this was only a vaccine for the elderly and for the vulnerable, but we knew that this was where it was going to go. So we wanted to get on the record. Sorry, is it not very clear? We wanted to get on the record and preempt any suggestion of rolling out the COVID jabs to children. So we laid out solid safety and ethical reasons as to why this should never be considered. So you can't see it and you don't really need to see it. But we concluded that it would be irresponsible and unethical, as well as unnecessary, to include any children under 18 years in either the national COVID vaccine rollout or in any clinical trials. And we urged the regulators and the government to apply the precautionary principle. And I would say this conclusion still holds today, a year and a half later, with a wealth of further evidence and real-world data strengthening this position. Okay, so over the last 2.5 years, I think we've witnessed a dangerous erosion of core ethical principles underpinning civilized society through these misguided and unethical COVID policies. And we have witnessed politics and medicine increasingly being practiced in a moral and ethical vacuum. And this has caused medical practice to become more and more dysfunctional and dangerous for patients. And I think this is the time we must take stock and take action to return to core ethical principles in public health. So my talk today, I'm going to give you an overview of medical ethics. Then we're going to look at where we are now and what went wrong. We'll be asking how did we get here, and most importantly, how do we move forward? So these cornerstones of ethical medicine have been established and practiced for centuries. They recognise that there's a fundamental imbalance of power in a doctor-patient relationship. The doctor is in a privileged and very responsible position dealing with a patient in a very intimate and vulnerable situation. And so there is a need to protect that patient from potential abuse. And I think it's worth remembering that the whole point of ethical principles is that we must hold firm to them, not just in the easy times, but in hard times and emergencies, because they are there to prevent abuse and prevent atrocities from happening. And that is far more likely in an emergency situation when there is panic and fear present. So ethical principles cannot just be thrown out on a whim. So the practice of ethical medicine happens in the context of what is known as the sacred doctor-patient relationship, where the doctor is instructed to first do no harm. They are under their Hippocratic oath. They respect the bodily autonomy of their patient, and they practice informed consent for anything that they want to do with the patient. And so going first of all to the doctor-patient relationship, an ethical model for this is the patient-centered model. So in this model, the primary duty of care of a doctor is to the individual patient in front of them. So the doctor is not to be concerned with their employer, with the NHS in the UK, the government, or wider public interests. The doctor has to be the patient's advocate. They must act in their best interest, taking into account their physical, emotional, and spiritual or philosophical needs and wishes. And the principles of this practice include first do no harm and informed consent. So I don't think there's a doctor anywhere in the world that would not recognise the Hippocratic Oath, which is recognised as the founding principle of medical ethics. Although it's over 2,000 years old, it gives clear moral guidance and accountability to doctors, encompassing the following tenets. So the doctor must first do no harm, so they must ensure that the benefits of any treatment outweigh the risks for that individual. And that will ensure that all medical treatment is proportionate, necessary, and voluntary. There must be confidentiality, otherwise how could there be trust? The doctor is instructed not to conduct any research without patient permission, and they must pass their knowledge on to the next generation of doctors. Now, bodily autonomy is the fundamental right of each human being to self-determination over their own body. And I believe it's the foundation on which all other human rights are built, because if you don't have agency over your own body, you can effectively become a slave or agent of the state or any health authorities. And then informed consent, that's the other key principle, which is a medical ethics and human rights principle. And it's the process by which an individual gives permission before they receive any type of medical treatment, test, or examination. And in the UK, and I think around the world, to be legally valid, consent must be voluntary and informed. This information must be on the basis of an explanation by a clinician, and that clinician must share risks, benefits, and any alternatives to treatment. The decision must not be influenced by pressure from the medical staff, friends, or family, and the person consenting must have the capacity to make the decision. And as you no doubt know, the Nuremberg Code was drawn up following the atrocities that were carried out by the medical profession under the orders of the Nazi regime in World War II. And it was an attempt to prevent anything like that ever happening again. And relating to medical experimentation on human subjects, it encodes that the voluntary consent of the human subject is absolutely essential. and that there should be no element of force, fraud, deceit, duress, or any other forms of constraint or coercion. And there are many, many other codes, laws, and declarations all around the world, which include these ones on here. So that was your quick whistle-stop tour of basic medical ethics. Now we're going to move on to what went wrong over the last 2.5 years. So even before the vaccines were released, and in fact when we started the UK Medical Freedom Alliance, the policies around masks and testing had already challenged these established principles of medical ethics, because all medical interventions, treatments, and vaccines have risks of harm as well as benefits, so must be subject to informed consent and therefore voluntary. So all of these mandates would appear to override these ethical rules. And I think one of the things for me that's been the most shocking over the last 2.5 years is how the medical profession have stood by largely silent, as under emergency laws all around the world, one by one, fundamental ethical principles have been abandoned and previously hard red lines have been violated. So there's a few pictures there, and I'll just give a few examples. So we have, as we've discussed today, rolled out a novel gene-based technology with no long-term safety data, not only to those most at risk from COVID, but to the whole population, including children and pregnant women, regardless of the risk from COVID and regardless of their immune status. To me, that is reckless in the extreme. And there's been no regard to the precautionary principle and a massive lack of concern over safety. We've seen many, many ethical violations concerning children. So there's been the idea that we can somehow use them as human shields. We mask them or vaccinate them to protect granny. We've closed their schools. We've made their learning conditional on them wearing a mask, despite the huge evidence of physical and psychological harm. Also, it was very disturbing, this use of Gillett competence in the UK or other countries, allowing children to consent themselves without any parental knowledge or permission to these vaccines, making them extremely vulnerable to peer pressure and wanting to fit in, and also, not having access to all the data or having really the understanding, the long-term understanding that they would need to be able to do that. We've also, in the UK and I think elsewhere, vaccines have been given by non-medically qualified individuals. So how could informed consent ever happen? Because they're not being discussed with someone who understands the patient's medical history or medicine generally. We've had vaccine mandates in order to access basic human freedoms. We've had incredibly coercive and emotionally manipulative marketing of vaccinations to the public, a mass use of propaganda by government and health officials. Then another ethical violation, there's been a complete failure of regulators to respond to glaring safety signals in vaccine safety surveillance systems. And then on other issues, we've separated loved ones who are sick and dying and forced people to die alone. And there have been gross violations of medical privacy and confidentiality. And I think it's no surprise that given these gross violations of human rights and dignity, that we've seen mass protests all over the world, from the UK to the US, across Europe, Australia, Canada, and New Zealand. So it's worth looking, I think, briefly at how informed consent has been grossly undermined regarding giving COVID vaccines to billions of people. So the risks, both known and, importantly, unknown risks, have been not clearly stated or, in many cases, have been deliberately hidden. The benefits have been massively overstated, particularly to young and healthy people. And then we've had the use of coercion, blackmail, and threats in the most astonishing ways across the world. People have been offered free lap dances, free lottery tickets, all sorts of just extraordinary things which I don't think have ever been seen before. And so I just threw together a list of some of the points that all people should have been made aware of, probably right at the beginning of the rollout. There's even more now. And been given the opportunity to discuss with a clinician before taking the vaccine, and been given time to consider. And if you look through that list, I think it's doubtful whether valid, informed consent has been obtained for the vast majority of vaccines given. So I think to get out of this mess, as I said before, we need to understand how did we get here, and why the medical profession was so ill-equipped to stand up for fundamental ethical principles and to hold the line over the last 3 years to protect their patients. So I've come up with about 3 or 4 strands. So the first one, which Aaron Cariati, the former professor of psychiatry and medical ethics at the University of California, calls Hippocratic versus technocratic medicine. So it's this patient-centered, the move from patient-centered medicine, which is the ethical model, towards protocol-driven medicine, which has been happening over the last 2 or 3 decades. And in this, we started with guidelines, but increasingly guidelines have become protocols and algorithms, forcing doctors to basically take a one-size-fits-all approach to patients. And this approach dehumanizes patients, fails to recognize their individuality, but it also deprofessionalizes and de-skills doctors, so they just become automatons, just following an algorithm. Then we have the hijacking of evidence-based medicine. So when I was doing my training and my doctoring a couple of decades ago, evidence-based medicine came in and it seemed a really good concept, but I think over the last 20 years it's become increasingly reductionist and highly selective. It's only favouring now pharma-generated evidence. Randomized control trials were always called the gold standard, but it seems that they're now the only evidence accepted, but they only really suit drug trials. So this is sort of led to an overemphasis of the science of medicine. Now, we need to remember that science does not have moral or ethical values inherent in it. So it can't inform the practice of medicine alone. We need doctors, human beings, to apply ethical principles and moral values and interpretations to science in order to practice medicine humanely. And we've lost the art of medicine. That's the human side. The experienced clinician, their observation, their intuition, their wisdom, compassion, and also innovation, the willingness to go back to first principles and not just follow a protocol, but work out what's going on with the patient in front of them and how they can use their experience and the drugs that they have access to work out how to help that person. And then we've given public health excessive power. Public health tends to and has increasingly become a sort of a greater good ideology where we are increasingly allowing individual harm to be accepted for the good of society. This is completely the antithesis of the sanctity of each individual life. And it also has then allowed governments and health officials to effectively, through public health, practice medicine on individuals that they do not know. And then we have the wider environment, where I think it's very apparent now that there has been a capture of the regulators, the scientific journals, the academic institutions and politicians by the lobbying and the money of big pharma. So in this environment, you have basically the vested interests dictating and controlling medical practice for financial and political gain. And there's these contextual factors specific to COVID, which clearly show that we cannot allow corporations, bureaucrats, or governments to effectively bypass doctors and practice medicine by diktat. Doctors must stand up, and nurses and all healthcare professionals, to protect patients from this medical tyranny. So Thomas Jefferson commented on the dangers of allowing the state to dictate medical treatment. I think this is a really interesting quote. And I think it's imperative at this point that we recognise that we're already a long, long way down the slippery slope to a medical tyranny. I think the Mary was mentioning earlier this really sinister development in California, also being echoed in Queensland and apparently in Turkey as well, where laws are being passed to sanction doctors who express any opinion that deviate in any way from the medical orthodoxy, which is dictated by the government and pharma. And that is not just in public, on social media or in talks, but also in private medical consultations. I think this is extremely sinister, it's extremely dangerous, and effectively reduces doctors to becoming mouthpieces and agents of the state. So medicine is not an exact science, it's an applied science, and it's constantly updated and refined as new information comes in. And the appropriate treatment will be different from one person to the next, because we know we are not all the same. So one size can never fit all. Therefore, this law, it cannot end well. There can also be no consensus in science because, by definition, the scientific method involves constantly questioning and challenging hypotheses. You need debate in science in order to progress and refine knowledge. And it raises the really crucial question, who is the arbiter of truth? Whoever is the arbiter of truth in this sort of Orwellian dystopian world will have immense power and also the potential for great atrocities that will be committed if doctors cannot follow their oath and act in the best interest of their patients. So, how can we move forward? I think we cannot expect this to be solved from the top down. This is going to have to be a grassroots medical profession, healthcare profession driven return to patient-centered medicine. And I've just thrown together a few ideas. I think we need to relearn the art of medicine. We need to accept that science is never settled. Doctors and healthcare professionals need to start to critically think again. We've had a lot of second-hand opinions, people reading the medical journals, the medical media, and being told what to think instead of actually engaging directly with the data. We need to reject cancel culture as a profession. It's not healthy. We must embrace debate and be comfortable with debate. We should call out corruption when we see it. We need to restore scientific integrity. It should be desired that people have intellectual humility, which is when the facts change, we need to be prepared to change our minds and avoid any sort of dogma. Underpinning all of this, we must re-establish the core ethical principles that cannot be thrown aside in any circumstance. We must be our patient's advocate. And actually, I think the model of healing has now become so narrow and so pharmaceutical driven. We must widen that to include all the other modalities of healing, natural, integrative, functional, nutritional medicine. So one example of a very effective doctor-driven response to counter medical tyranny and reclaim the profession and the Hippocratic Oath was the Global COVID Summit. And they sought to reclaim and invoke the Hippocratic Oath and its fundamental principles for humane ethical medicine. They've done several declarations since September 2021, including the Pediatric Declaration in June this year, relating to COVID policies causing damage to children. And they called for an end to masking and testing of children, as well as a halt to the vaccine rollout to children, and for parental medical decision-making not to be denied. And we've just got a few exciting initiatives I wanted to report to you in the UK, and groups of ethical doctors coming together. So at the UK Doctors Conference held a few weeks ago this autumn by the World Council for Health in London, we launched this UK Doctors Declaration. And you can go to and look at it on the World Council for Health website and sign it along with an open letter to the General Medical Council, which is the UK medical regulators, calling for them to uphold their own good medical practice guidelines. And so these were the 10 points that we have declared, and we have got many, many signatures. Then we've got Doctors for Patients UK. It's really recently formed, only a few weeks old, but it's fast growing, and it's a group of doctors who want to uphold ethical, patient-centred care. And they're holding weekly Zoom educational meetings, which any doctors are welcome to go to, in an attempt to try to start the old grand round system, where doctors would go and present patients and then discuss them, and people would give their input and they would debate over what the best treatment would be. So we have a presentation followed by a question and answers and discussion. And it's also, we're using it as an opportunity for doctors to invite their colleagues who may be more in the mainstream to come and actually engage with the information. And we've had some amazing speakers. We had Peter McCullough this week, we've had Paul Marrick, but we've also had doctors within the group talking about their experiences, and a wide variety of subjects. So it's really, really great initiative. And then I'm part of the Children's COVID Vaccine Advisory Council, which is led by the retired paediatrician, Dr. Ros Jones, who I'm sure you've all heard of. And we have been challenging the authorization and rollout of COVID vaccines to children since May last year. We've now written 9 open letters to the regulators and the chief medical officers, and most recently to the Prime Minister, who was very briefly Prime Minister, regarding vaccine safety, ethics and consent. And we then put the letters up, and they've been signed by hundreds of doctors. I think the most has been about 650 or something. And we are calling for an urgent halt to the rollout to all under 18s. And there's a picture of us at the end of September, a few weeks ago, hand-delivering a letter to our brief Prime Minister, Liz Truss, that was signed by many, many doctors. So I'm just going to give the final word to Benjamin Rush, who said these prophetic words over 200 years ago. He said, "Unless we put medical freedom into the Constitution, the time will come when medicine will organize into an undercover dictatorship to restrict the art of healing to one class of men and deny equal privileges to others. The Constitution of the Republic should make a special privilege for medical freedoms as well as religious freedom." I think that time has come.